If you're a pregnant woman and that pregnancy is 20 weeks and above, and you are observing these three symptoms I'm going to list now. Now, listen, if you notice these three symptoms I'm going to list now, do not ignore it. Quickly report to your healthcare provider, report to whosoever that is managing that pregnancy. Okay. Number one, if you're noticing headaches, you're also noticing chest pain, kind of epigastric pain. You're also noticing that you can't see things clearly, blurry vision. If you have these three symptoms, and your pregnancy is 20 weeks and above, please quickly report to your healthcare provider because it's possible you are developing high blood pressure without knowing. A woman can have a normal blood pressure when she is not pregnant, but when she is pregnant, she can develop high blood pressure. It is as a result of the pregnancy. It is pregnancy induced hypertension. So do not ignore it because it is not good for you and your baby. It can affect you and your baby badly. So don't ignore it. If you notice any of these symptoms, quickly report to whoever that is managing your pregnancy for you. All right. I hope this was helpful.
Five mistakes that can harm your baby during pregnancy. Number one is when you're not taking enough water. You skip meals when you're not taking your prenatal vitamins. Not being active except your pregnancy requires bed rest and when you're not getting enough sleep.
Signs of blocked fallopian tubes. Signs which shows as a woman it's possible your fallopian tubes are blocked. Fallopian tube is where fertilization takes place. These tubes, they are two in number, attached at the both sides of the uterus, that is your womb. If these both tubes they are blocked, pregnancy becomes difficult. But if one is blocked and the other one is open, a woman can still achieve pregnancy with the one that is open, as long as the ovary attached to it is releasing mature follicles. Okay. And how would you know that your fallopian tubes are blocked? There is a test called HSG. Is an X-ray. Okay, that will look at your tube to know if they are blocked or not. These signs of blocked fallopian tube manifest based on the cause to that blockage of tube. There are several conditions that can actually result to blockage of fallopian tube. Number one is PID, which occurs as a result of poorly treated STI like chlamydia and gonorrhea. Number two is endometriosis. Number three is tubal ligation or previous pelvic surgeries. Okay, even fibroid can also result to blockage of fallopian tubes. Okay, so what are these signs that you will see that will make you to begin to point towards blocked fallopian tube? Number one is when you are finding it difficult to conceive. Yes, a woman with blocked fallopian tube will find it very difficult to achieve pregnancy. Number two, you're experiencing severe menstrual cramps. Okay, that is another sign. Number three, your menses becomes irregular. Sometimes it can be very heavy, or sometimes you might not even see it at all. You can also experience VG discharge that will be very, very offensive, or it might not be offensive, but it will be heavy VG discharge. That is another sign of blocked fallopian tube. You also experience pain when you are meeting with your partner. These are possible signs of blocked fallopian tubes. So if you are noticing any of these signs, it is important you go and see a gynecologist as soon as possible. Thank you. Don't forget to share. See you in my next video. Bye bye.